Is your life better? Are you happier? Is everything better now that you're slightly smaller than you were before?
Absolutely. And I'm not a little bit smaller, I'm a lot smaller. I can still have kids, and that may not have happened if I had stayed the size I was. Like, my question to you is, can you honestly say that you are 100% happy and healthy?
I think it's really interesting that I feel like I need to justify my existence in this room. I just think that that this is the way the discussion is running.
Hey, good morning, good afternoon, or good evening. Thanks for tuning in. In this podcast, we are taking a closer look at changes in how people talk and think about obesity and weight loss. We're going to talk about some recent weight loss product launches and the media frenzy that has been unleashed. We did a 5-year look back analysis of social media conversations around obesity with emphasis on how these conversations are evolving. And with us here today to discuss the findings are Cesar Castillo, Human Experience Lead and Cultural Anthropologist from Nagarro, Nancy Kinsler, Vice President of Insights and Analytics from Envision Health Partners, and myself, Madhunika Raghavan, a Managing Partner at Envision Health Partners. Before we dive in, I will tell you that this is the first of a series of podcasts on this topic. And today's topic is going to be about key learnings from the social media analyses. In the next one, in a few weeks, we will showcase feedback from physicians who have a focus on treatment and management of obesity in their practices. So definitely bookmark this podcast and join our conversation. Over to you, Cesar.
Thank you so much, Monica. It's such a pleasure to be here, have this conversation with you all today. So first of all, in this analysis that we conducted, this 5-year analysis, we looked at over 1 million social media posts over a range of conversations. And when we looked at obesity and weight loss at this scale, we noticed 3 main discourses. One of them, which is one that most people are very commonly associates the whole weight loss discussion, is this lifestyle discourse, right? And it's about fad diets that are unsustainable, or people looking for alternative healthy remedies, or even how life and work get in the way of their weight loss journey. And then you also have the medical discourse. Again, people are very familiar with this, where people are saying that the medical system really focuses on reactive solutions versus that proactive, again, alternative stuff they're looking for. And people really want more culturally sensitive and in general, more inclusive ways of addressing weight loss. Now, the third conversation, and this is one that I believe is in some ways the most problematic, is something that we label the social political discourses. Now, these are all about blame. You know, who's to blame for obesity? Is it diet culture? Is it the celebrities on social media? Is it food industry? Like, who is the person to blame in this whole weight loss obesity discourse?
Yeah, no, thank you, Cesar. I mean, this is a great way to get us started. And it's really, fascinating. It was really fascinating for us to look at this data alongside the Nagarro team. And I think one of the things that really stood out to us was this common source of disconnect, across these different narratives. They are sort of competing narratives, and come at it from different ways, but the root cause seems to be really this idea of how healthy is defined. And
Yeah.
so we see such differences in how people think about this, depending on their environment and their point of view. And so it's definitely something for all of us in the industry to consider as we think about products or solutions or resources, to help patients find the care they need. But for now, let's keep going, as I know our listeners are going to be very interested in the differences we saw by gender, ethnicity, et cetera, on this topic.
Yeah, of
So,
course.
yeah.
And if I could jump in here, I'd love to talk about the differences we saw in the genders on these discourses. And one of the things that really popped out to me and surprised me was that the actual volume of conversation happening around obesity and weight loss is equally divided between men and women. And, based on my own experience and bias and whatever, I would have expected it to be much more heavily weighted towards women having the open social conversation around obesity and weight loss. Cesar, what are your thoughts on that? Why do you think, we ended up with this kind of balance?
Great question, Nancy. So it's interesting because when we think conventionally about weight loss and it really is aligned with the conversations that women lead in social media. So for women who have almost half of the conversation on social media, it's about the struggles to lose weight. It's about feeling good in one's own body and also finding holistic alternatives. So this is what we usually think when we think about the weight loss conversation. However, what we found through the study is that men are communicating in this conversation more or less at an equal volume, but the themes are different. So men talk about physical, what we call physical oriented themes, building muscle to lose weight. This idea of comorbidities, for example, high cholesterol, high blood pressure, heart disease being triggers for one wanting to lose weight. And also a trend that we've seen in recent years around biohacking. So the themes are very different, but the amount of conversation is more or less the same.
That's really interesting, Caesar. So clearly, weight loss and obesity are topics that do not discriminate by gender. Very interesting to see this.
I'd also like to talk a little bit about this one because the differences we saw between different ethnicities and cultural backgrounds were maybe less surprising, but still really fascinating, especially when it comes to the BMI conversation. So, we did see in the conversations, and your analysis was able to tease out, Caesar, that the conversation around BMI and how BMI is problematic really comes to the fore among the African Americans who are out there talking on social media and other forums. And that there's the feeling that BMI just doesn't fit the body structure, the actual anatomical body structure of African Americans, and really this desire for there to be some other standard to hold patients to instead of BMI. And then on the side of the Hispanics, those of Hispanic culture, there's this other idea that it's beyond BMI, which they also feel, may not apply to their body type. There's this sense of like, it's really hard to lose weight in Hispanic household, which that piece I found quite surprising.
Yeah, this discussion on BMI was really fascinating to observe in social media. And in fact, AMA has acknowledged that the BMI is an imperfect tool and it doesn't really account for differences, in ethnic groups or genders and what have you. So I'm curious, Caesar, did you see convergence around any other metric? Are there any other measures that seem more popular with groups of people?
So, Monica, there is no convergence. So, we're finding many discourses, as we said before, people want a more inclusive measurement of sorts, um, but it's really up for debate. So, it's all goes back to what we said earlier. How is healthy defined? And to Nancy's point, there's these factors such as your household. I'm a Hispanic male, and I also align with this discourse that we saw in the Hispanic conversation around, it's difficult to lose weight in a Hispanic household, right? So there's cultural factors, there's other factors that make it different for these different realities. And like we said, there's no preferred indices that's identified by the different cohorts. However, there is consensus that there needs to be something else.
Ah, interesting. So people are pushing back on any singular way of defining a healthy weight, and kind of ties back to the very first slide we saw here. There's just different ways in which people think of what healthy means to them and how it should be defined. But moving on here.
Yeah, and here's another really interesting transition we've seen. Over time, there's been a shift in what we know as the body positivity movement, which many of our listeners might be familiar with. It started originally as a way to promote self-love and acceptance, and then what you're seeing is a transformation of that narrative. Now there's a lot of angst in the media conversation because there's this concept, this theme around obesity glorification. So now we find that the pendulum is swinging again towards a clearer distinction between what are appearance standards versus what is really the need to treat obesity as a medical issue.
Huh. It's interesting you say pendulum, Caesar, because that brings to me a visual of something, swinging back in place. And so I wonder what this means for the current narrative around treating obesity as a medical issue and something, that needs to be treated.
Yes, and to that very point, Monica, more recently, we can see that across these different social media channels, there's new influences in the form of what we know as those new treatments that are emerging. Now, this isn't news for us or perhaps our listeners, but these new treatments have really been sparking the debate on social media. So for some, these treatments are a beacon of hope for what they consider a serious and stubborn health condition. Now, for others, the conversation is more negative. We see people say that, oh, they're shaming their use for cosmetic reasons. We see complaints on the high prices being a barrier, especially for those ethnic cultural cohorts we saw just a little while ago. And there's a fear around side effects too. People are really divided between should I consider these or should I not consider these medical treatments?
Yeah, definitely. And when you start to think about the fact that people are now considering mental health effects on negative body perceptions or the link between mental health effects and obesity, it is beginning to feel like the conversation scale is tipping in favor of these medications or treatments, for weight loss. But I think it remains to be seen because at the end of the day, based on all the conversations that we've analyzed, one thing is very clear. There's lots of tensions in these conversations that really need to be unpacked. And it really does seem like these new treatments will fuel these obesity conversations, at least in the short term. But the question is, how will they do so? Because the real world evidence, or the real world experience with these treatments is going to be very important, and how they're presented to the world by their manufacturers will be critical, to shaping their narrative, right?
Hmm.
That said, I think the big question sort of remains, will these medications offer an opportunity to rest the debate on whether, obesity is a lifestyle issue or a medically treatable condition? Will they continue to fuel resentment among those who cannot afford them or grow stigma against patients who opt for these treatments? Or will these medications offer freedom from the tyranny of these weight loss cycles that patients go through, right? Throughout their lifetime in many cases. Or do you have to stay on these medications forever, to maintain the weight loss? With that, like Nancy, Caesar, any final comments on what we've looked at so far?
Well,
No,
like you
none
said,
from me.
yeah, and like you said, Monica, research like this, the beauty of it is that it poses new questions to be explored, right? And
Oh, totally.
it's so
Totally.
interesting that now we have a direction to where we need to think deeper about this.
Fabulous. Thank you both. This has been a fascinating discussion. And to our listeners, thank you for joining us today. And let me assure you that this is not everything we've learned. It's just the tip of the iceberg on this topic. Nancy and I will be spending quality time with physicians who have a clinical interest in treating obesity and ask our experts actually to weigh in on some of these topics. For example, we're very curious to understand, how does this evolving narrative play out in their offices today? What is the impact on the patient-doctor discussion and relationship? How do they counsel patients on eligibility for some of these newly launched medications? And really, where is this headed? What does the future hold? Will the evolving narrative motivate patients to seek help? Or is it going to create new problems that's already going to burden these very, very busy healthcare providers? So that's it for today, folks. But I invite you to join our conversation. Look out for our next podcast. Think about what we've shared today and do reach out with any questions. Thank
Thank
you.
you. Thank you.
Thank you.